Dr. Welch, thank you so much for being here with us. I mean, what a time to be a health director, huh?
Yeah, but I'm telling you, I'd much rather be a health director than the school system right now.
That's for sure. Everybody making big, important decisions these days. So let's talk about the latest. All right.
Sure.
We've been seeing a rise in cases. Can you translate that for us? We see a lot of graphs and numbers. What does it mean for us?
Yeah, it certainly can be confusing. And I have to say, I'm continually getting educated by the epidemiologist as well, because we're certainly in the epidemiology field here. And we were at a flattened curve. And at the beginning, you heard lots of conversation about flattening the curve, wearing the mask, staying inside. And people were very cooperative with that. And as a result, we were at a flattened curve. Our percentage positivity was about 5%, 4%. It was relatively small. But then concurrently with when we moved into this phase 3, we saw not only a soaring, but almost a vertical upward tick of, yes, increased testing, but more importantly, increased positivity. And I want to share why it's not simply a result of the increased testing, because I know that can be very, very confusing. The increase in testing and how people may misinterpret it to say that the positivity is directly related to the testing. The bottom line is that what we're trying to determine, is it related to testing or transmission? Those are the key differences and key points that have to be considered. If it's related, when you have, well, let's use just a simple example. Say you had a 10% positivity rate out of 100 people. And then next week you're testing 200 people. If there is no increased transmission, in other words, no increase in the amount of the disease, then you're actually going to see a decrease in the percent. Okay. Because you just have that same number. Or if the transmission is just sort of level and not increasing, you're going to stay at that 10%. But that's not what we're seeing. We are seeing a huge, almost vertical surge. And today I would tell you that I just heard further confirmation that it's related to transmission. I wasn't aware of this until today. But there is, again, an epidemiological, mathematical way, one determines transmission. Okay. And what they shared with us today is that the transmission rate in the eastern region, not statewide, the eastern region, has increased by 50% just over the past several weeks. What that means is the amount of people being infected by one individual is up by 50%. And so that confirms that the increase in our positivity rate is a true reflection, unfortunately, as much as I would like for it not to be, but it's a true reflection of the transmission and increasing transmission, therefore increasing exposure within our community.
So we're really bringing it all back to high school math is what I'm hearing, you know, like.
Don't tell the epidemiologist that.
No. But to help us wrap our brains around, you know, how good it is that we're doing all of this extra testing, but we are seeing the extra positive cases, but it is not, it's a matter of percentages that we're going by. That's what you're saying.
It's about percentages, a number of, and trends. Okay. It's percentages and trends. And don't ask me to explain the mathematics because I have no idea. That is an epidemiologist's forte, not mine. But it is going by percentages and trends. And as I explained, I'm just putting it in 100 versus 200, simple math kind of thing. And I think it's easy to understand from that simple math that if there was no increased transmission, you would see either the same or decrease in the percentage. And
Makes sense.
goodness, that's not even close to what we're seeing. We have
We'll
seen
put up a
dramatic
couple
increase.
of examples of the graphs that you've shown us, because it really is quite striking when you put it in that kind of format. It's more than just numbers. You see that
Right.
line going straight up. Let's talk a little bit about testing. So we have done a lot of it here in Chesapeake. We have heard from various people that it can take a long time to get results. Is that true? Is there anything we can do about it?
It is true now. It didn't used to be true. You may remember when we first started testing, we were only testing those who had symptoms. And so when you look back, number one, when you look back at that chart, you see certainly a high positivity, which we would expect because they were symptomatic. And that's not the case now, because we're testing anybody so that we can get some greater idea of prevalence. So the increased testing has put that's statewide, has put an increased demand on the labs in terms of their timeframes of doing the test. And unfortunately, it is taking anywhere from 5 to 7 days, which quite frankly, from a medical health epidemiological perspective it's hard to work with.
Yeah.
Because it's after the fact then that we are seeing that individual may be positive, and then you've got contact tracing to go along with that. So I'll be honest, we are, and this relates to something else, which we should interject at this point.
Sure.
And that is, along with that increased volume, we had to ask the question, well, why do we have the increased transmission?
Yes.
Obviously, when we first recognized it's not because of increased testing, but increased transmission.
That's very interesting, that point. So not only are we seeing the cases rise, but included in the increased testing, we're testing people who 2 or 3 months ago wouldn't even have thought to get a test. Right. Because they're not presenting any symptoms.
Right.
That is very telling. Interesting.
But it's been good that they've presented for testing, because what it has shown us is that along with the increase in positivity, along with the increase in testing, along with the increased surge associated with moving into phase 3, what we have seen is a dramatic takeoff of the positivity being in the 20 to 49-year-old. And they just soar way above all the other age groups in terms of positivity. And that's especially significant, not only in terms of recognizing it, which is obviously the first step, but this population also has a greater chance of not having any symptoms, but still being infected and still being contagious. In fact, I even checked with the emergency room today, and what they are seeing in terms of folks coming into the emergency room also is, I think, an association with this increased trend. They have seen a reduction from an average age of 48 to 37 since April. Now, I'm not saying all of that is COVID. Obviously, this is the whole gamut of folks coming in. But there's no doubt that this population I'm mentioning to you is playing a role. So although they traditionally are asymptomatic, contagious, and the spreaders, they're also beginning to experience some symptoms and some worrisome symptoms, enough to come into the emergency room. Which is kind of interesting, because traditionally when you have a group such as this 20 to 49 asymptomatic spreaders, you would not expect to see an increase in deaths soon, which we're not. Not surprising at all, because these are asymptomatic, they do well. What you don't expect to see an increase in deaths until the virus sort of gets out there outside of their social circle, because they socialize with the same group. They're going to the bars, they're going to the gatherings, they're going to the beach. They're, as everyone does, you socialize within your own age group. And so they're not asymptomatic and having problems. So generally it takes what's called 2 to 3 transmission cycles, or 4 to 6 weeks. because the incubation period is considered 14 days.
Okay.
I mean, 4 to 6 weeks, yeah. Taking 4 to 6 weeks before you're going to see a death impact, because it's got to get out of that social circle. So when someone transmits it to someone else who then goes and visits grandma, or transmits it to someone whose spouse has diabetes, or whose child is on prednisone and at risk. So it takes a couple transmission cycles to get outside that social group, because that social group has such a low risk of severe disease and death.
It feels like so much with this virus is quite sneaky. You know, there are
right.
people who just totally know that's it, I have it. And there are some people who think, well, I don't know, I've had the sniffles, but don't I all, you know, so that's,
Right.
so there's also the question of kind of like that 6 degrees of separation Kevin Bacon game.
Right,
You know?
right.
My friend who I saw, her friend got tested positive. Does that mean how do we know when we should get tested?
Well, one is contact tracing.
Okay.
And I will say, and it's a great intro to where you're going, is that because, as I mentioned earlier, we're increasing demand on contact tracing as we're increasing the positive cases. And having done the tests, which remember, those tests are just one point in time. So there's a good chance that a lot of those negatives may have subsequently become positive, or either through contact or other reasons. But we are now, because of that great surge, because of that huge surge, and it's in that population, and we know, unfortunately, it's happening in the bars and social settings that I mentioned, where on phase 3, we just saw a tremendous laxity, a change in cooperation with the protective measures. We are actually going to decrease our testing sites and move instead into trying to get people to understand the value of the masking, a greater masking campaign. It sounds so simple that people ignore its value because it's so simple. And I'm sure I've seen so many comments related to this that just downplay it. Yeah. But it really is a very simple concept that's been tested, tried and true, and really works. It's not initially protecting you, but it truly is getting back to the mode that protecting each other protects us. Right. It's a very simple mode, and I think relatively easy to do, but it is hard to get that. So I've been talking with our PR person, other people in the community, trying to get ideas of how we can reach this population. What is it that will help them to understand the value of doing it? I will say, yes, we are increasing enforcement, but I hate to see enforcement be the reason.
Right.
You know, I hate to see a decrease in caring for other people be the reason. I'm old-fashioned enough.
Yeah.
So I don't like to see that be the reason. And so I don't want to rely completely on enforcement.
Yeah. Well, I'll tell you what, I was hoping that they would just become the latest fashion trend.
Yeah,
I got my glitter mask. I'm ready to do some bedazzling. So I don't know, maybe that's
a new necklace.
Yeah.
You put it on.
For so much with this, we really are relying so heavily on science and data, and that we've got to do that. I mean, you know, I think about the way that I explain to my 2-year-old to catch her sneeze in her sleeve. That makes sense to me because it is blocking particles from coming out of your mouth and into somebody else's. So give me the real quick synopsis of why masks, although not perfect, why they work in this situation.
Yes. The mask provides a physical barrier, nothing more complicated than that will prevent large droplets. COVID is a big droplet, not measles. Measles is aerosolized, it's small. COVID is a big droplet. It is a physical barrier that prevents those big droplets from going from your mouth outside to the environment. So it's purely a physical barrier.
Easy as
But by everybody wearing the mask, just sheer math, you're going to have far less virus and germ in the environment. And just by sheer numbers, therefore, you're going to have less risk of you being exposed. Because, and I would tell you sort of a little helpful tidbit that's not even a part of that barrier component. The entry to your body for this virus is basically your respiratory tract. That's your door. Mm-hmm. And that's what you're trying to prevent those viruses from getting to. Well, some people did a study on how many times you just touch your face in an hour. Now, I can't imagine doing that study. So,
I
know. Counting. But anyway, they did it. And they found an average of 23 times an hour.
I believe that.
And
because now I need to touch my face.
Right, exactly. 23 times an hour, where each one of those 23 times, if you haven't been washing your hands, or if you've touched something just after someone has wiped the nose and then touched the doorknob, is an opportunity where you basically have taken that virus to your door. Right. And the mask, interestingly enough, closes the door.
Yeah, sure.
You can't do this when you have a mask on. So that's another benefit, in that it is decreasing another opportunity to decrease the exposure of the virus to the door.
Now, what do you say to the people who say, well, I feel great, I'm not sick, you guys can wear your mask, but I'm not sick?
Mm-hmm. I say, I'm happy for you. And I probably say, it's good you're young. So yes, that's good. I'm very happy for you. I don't want people to be sick. But the reality is that you cannot tell when looking at somebody, young or old, who may have diabetes or who may be on immunosuppressive medicine or may be hypertensive. We don't place anything on our forehead that labels us like that. And so the kindest, most compassionate thing you can do is to understand you can't tell. And therefore to help protect them, because you're robust, you're not sick, but to help protect them by putting the mask on so that your virus won't get to them, to the door.
And that piece about your virus, well, if I feel healthy, that's the tricky part about this virus. I could still have it and could still be spreading it. Or maybe my symptoms just haven't started yet.
Right, that could be true too. And that's what we thought at the beginning, because this is a sneaky virus. Yeah. It's a virus that's smarter than us. What can we say? Because we don't have anything else like this.
Yeah.
We have, and that's why initially we only said those were symptoms to wear the mask, because we were basing it on what we knew. And what we knew was, yes, you could have 2, 3, yes, and some diseases not transmitted by respiratory, but some diseases at several weeks. But there's a pre-symptomatic period. But generally speaking, if you have the virus, you're going to have symptoms. Yeah. So we were basing it on our experience. Mm-hmm. But then science came out with more research that demonstrated how sneaky this virus is. Yeah. In that there's 30 to 40% of folks, mainly in this age group I just mentioned, who have no symptoms. So they feel great. So having symptoms with this virus can no longer be a clue or a, hey, wow, wait, kind of moment to think I could have the virus and I could be sharing it. Simply breathing, being alive, means you could have the virus and no symptom.
Now, another thing we hear often is that we don't mask for the flu, or we don't mask when we have a cold. So what is it about COVID-19 that makes it so different and makes that mask so critical?
Well, one is just what I said. Flu does not have that asymptomatic. If you have flu, you're going to have symptoms. You may have a couple days when you don't have symptoms, but pretty much if you've got the flu, you're going to have symptoms. So
Yeah.
that's a totally different story in that regard.
Okay.
I also need to emphasize that in the first 15 weeks of COVID, we had double the number of deaths from COVID than we had in 30 weeks of flu.
Oh, wow.
And keep in mind, that's with flu, we do have a vaccine for it, but we certainly still had a large number of deaths.
Sure.
So we can't even consider that. At least I'd love to see less deaths from flu,
Yeah.
because I'd love to see more people taking the vaccine, because it certainly helps in terms of severity and definitely helps in terms of symptoms. But we don't do it for flu because we have a vaccine. But we most likely do it for COVID when we have a vaccine. I guess there's a good chance we might not, but some people might because of that asymptomatic thing. That is not like flu. It's not like anything we have. So it may give us a little bit more thinking. But if we have vaccine, the question will be, do you have to take it every year like we do the flu?
Right.
And that's going to have to be the research. There's a good possibility it might be. I'm crossing my fingers that maybe it can be incorporated into the flu shot. That would solve lots of problems.
There's still so much to learn about this. So since we really don't have an end in sight to us wearing masks at this point, how can we survive summer and the heat while wearing these masks? Do you have any tips?
Yeah. If you can stay 6 feet apart, you don't have to wear the mask.
Okay.
That's the key. So if you go to the beach and you put your chair 6 feet apart, use 2 umbrellas instead of 1, so that you can still have the shade. But if you can stay 6 feet apart, you don't have to wear the mask. So that is certainly something for people to think about. And being outside. Now, if you're inside, again, the 6 feet rule pretty much holds as well. We wear masks at the office, but if we can be in situations where we're 6 feet apart, we may put the mask down, and that's okay, but we have to be 6 feet apart. So when you're outside, because the virus would just sort of go into the air and dilute or fall to the ground much quicker. And that's the thing, it's a heavy virus, not like measles, so it falls to the ground by 6 feet. So when you're at the beach, stay 6 feet and you can take your mask off.
Okay. Well, that's how we're going to do it, Dr. Welch, because we are going to wear those masks all summer long.
Good.
We have to until we get a vaccine and get some other direction from you and your staff. So we thank you so much for your work, Dr. Welch, and your entire team. We know that everyone is relying on the experts throughout all this, so we will continue to do that. Any last words for us here, Dr. Welch?
No, I just welcome any opportunity, and thank you for doing this.
Great. Well, we will talk to you soon. Stay healthy.
Thank you. You as well.